Hi, I'm Dr. Bertelsman from Premier Rehab. I hope this video helps you better understand your condition. Your lumbar spine consists of 5 individual vertebrae, all stacked on top of each other with a flexible shock-absorbent cushion in between each level called the intervertebral disc. A disc is made up of 2 basic components. The inner portion is called the nucleus, which is a ball of jelly about the size of a large marble. This jelly is held in place by the annulus, a tough ligamentous band wrapping around the nucleus, much like a ribbon wrapping around your finger. The term lumbar disc lesion means that your disc has been damaged. Disc lesions start when the fibers of the annulus become strained or frayed, much like a rope that frays when it's stretched beyond its limits. When enough fibers fray, this creates weakness, and when the disc is compressed, it bulges or protrudes, much like a weak spot on an inner tube. As more fibers are damaged, the jelly-like nucleus may actually herniate outward toward the nerve roots and spinal cord, which live directly behind the disc. Bulges that are accompanied by inflammation will likely create irritation of the sensitive spinal nerves, producing pain that radiates into your leg, also known as sciatica. Surprisingly, lumbar disc bulges are present without any symptoms in about a third of the adult population. Another third of adults are not so lucky, and they'll experience pain from a lumbar disc lesion at some point in their lifetime. Most lumbar disc problems occur at one of the 2 lowest disc levels. Disc problems occur more commonly in men. Smokers and people who are generally inactive have a higher risk of lumbar disc problems, and being tall or overweight also increases your risk. Certain occupations may place you at greater risk, especially if you spend extended periods of time sitting or driving. Researchers have found that most disc bulges will not require surgery. In fact, the majority of cases can be successfully managed with conservative care like the type provided by chiropractors. A research review of 90 clinical trials identified the most effective treatments for disc lesions and sciatica. The study supported only a handful of interventions, including chiropractic spinal manipulation, the natural option that chiropractors are uniquely trained to provide. Another study demonstrated that chiropractic treatment produced results equal to surgery in the majority of cases. The authors concluded that patients with symptomatic lumbar disc herniations should consider spinal manipulation first. And in addition to being effective, chiropractic spinal manipulation is one of the safest available options. Chiropractic care might include treatments like joint manipulation to restore movement to restricted spinal segments, therapy modalities to ease pain and swelling, myofascial release and massage techniques to remove long-standing adhesions and trigger points within the muscles, and exercises to restore flexibility and strength, thereby reducing your chance of re-injury. Your chiropractor may also consider therapies like lumbar traction or decompression to decrease disc pressure and relieve pain. So if you or someone you know suffers from a lumbar disc problem, consider the safe, effective, natural alternative first. I hope you learned something from that video, but more importantly, I hope that you'll consider us for your chiropractic care. Thanks for watching.